Hi, it's Dr. Steven Sigalove, board-certified plastic surgeon in Scottsdale, Arizona. So I wanted to talk a little bit about breast implants. We've kind of gone over what the process is for choosing breast implants in the past, but today I actually wanted to focus on the specifics of the implants themselves. And as everyone knows or may not know, there are various breast implants that we have here in the United States. And essentially they're broken up into textured and smooth. The textured implants, which have been used for years and years, typically have a very rough kind of almost sandpapery type of surface, which allows the implants to almost stick into place. The textured surfaces were great for many, many years because they offered stability of the pocket without movement. They also had a lower incidence of capsular contracture. And in Europe, for the last several decades, it's really all that they used. Fast forward to the last several years, and textured surfaces have been used less and less. And the main reason why textured surfaced implants have been used less and less has been because of something known as anaplastic large cell lymphoma, or ALCL. ALCL is an extremely rare form of a lymphoma which has been linked to textured breast implants. Certain companies, such as Allergan, more than others, Mentor and Sientra here in the United States. And because of this incidence of ALCL in the United States, which is thought to be anywhere from 1 in 3,000 to 1 in 30,000, we're not quite sure the numbers, and it depends on the study that you read, but because of that risk, we in our practice have chosen not to use textured breast implants moving forward. So that leaves us with smooth, round breast implants. Typically, we use silicone gel breast implants because they're more natural feeling and looking, and they have less rippling and wrinkling than the standard saline breast implants. Now, for those people who just don't want to use silicone because of various reasons, perhaps fear, breast implant associated illness, or what have you, saline implants are still available. They're heavier, more uncomfortable. They are cheaper, which is nice, but they have higher incidence of rippling and wrinkling, which is a negative side effect. So in our practice, the overwhelming majority of the implants that we use are smooth, round, silicone gel breast implants. Now, we can still get amazing results with incredibly low capsular contractures with these implants because of technique. And what we have learned about capsular contracture over the last several years is that capsular contracture is likely due to bacteria that can get in the pocket. So by reducing the bacterial load in the pocket, we can thus reduce the incidence of capsular contracture even with smooth implants. So we don't have to use textured implants anymore to reduce the likelihood of getting capsular contracture because we have technical ways of doing so. Antibacterial, meaning we use specific irrigants like betadine in our irrigation when we perform surgeries. We use what's called a no-touch technique. We use what's something called a Keller funnel, which is like a cake decorator, which we use to shoot the implant into the pocket so we don't have to use our fingers. We use antibiotics before, during, and after surgery, meticulous sterile technique, incisions that have lower incidence of capsular contractures, such as the inframammary incision, and other things. So by doing specific technical things, we can lower the incidence of capsular contracture. Now, to address the notion of stability of the breast implant pocket, the way we used to was to use a textured device. Nowadays, we have a product known as Galaform, which is a bioresorbable mesh, which basically can be sewn to the pocket to create a barrier or inframammary sling so that we can control the pocket with the mesh. The other thing that can be done is we can use this mesh called Galaform, made by Galatea, to actually surround the entirety of the implant. And this is a process that I call my ravioli technique. This is actually a technique that I have published. It's in textbooks and journals, and it's a very well-established technique in order to completely control the pocket, surrounding the implant entirely with mesh. So it looks literally like a ravioli. So this offers stability of the pocket, this offers control, and this offers more surface area, thickness, and volume, potentially in a thinner patient, to once again reduce rippling and wrinkling. So, smooth round implants can give the same wonderful, long-lasting, beautiful aesthetic results as the old-fashioned texture devices. However, we don't have the risks of ALCL. And in our opinion, safety has to come first. Safety becomes before everything else, because if you're not safe, it's just not worth it. So, smooth round implants, great results. We love them. Great long-lasting aesthetic outcomes in primary or revisionary breast augmentation surgery. If you have any questions on any of this, please direct message me or call our office and schedule a consultation. Feel free to leave anything below and I'll be happy to answer it. Thank you very much.